it's a very important sector, healthcare, and you've seen a breakdown of the promises made by then candidate of the APC, Bola Tinubu, in his manifesto, the Renewed Hope Manifesto, prior to being elected president. So 1 year into his administration, how much have we seen these promises come into fruition? Well, we have a panel this morning, but we're starting off with the immediate past president of World Medical Association, also the immediate past president, Commonwealth Medical Association, the past president, Nigerian Medical Association, a fellow Nigerian Medical Association and chief consultant family physician, Dr. Osahon Enabulele, joins us virtually from Benin City this morning. You're welcome to the program, Dr. Enabulele.
Good morning, Nigerians. Happy to be here again after a long time. Thank you.
Well, it's good to see you. I know we love our doctors, but you don't look forward to seeing doctors every day, because that usually means you'll have to go to the hospital, and it means that something is probably wrong. But this time, we are not diagnosing ourselves, but the health sector, based on the promises made by President Bola Tinubu. And in that manifesto, he described the healthcare sector as a matter of right and urgency. Let's pause on the right bit and look at the urgency. And I would ask you straight on, are you seeing a sense of urgency to begin with in this administration's approach to healthcare?
Yeah, thank you very much. First, to say that, let me just let you know that doctors are Nigerians. They are citizens of the world. And so it's not all the time you come to the hospital thinking that, oh, it's for diagnosis. There are issues of preventive care, for instance, just to keep you healthy and in a state of, well-being, to guarantee your well-being. So doctors are Nigerians, and they are friendly people. So don't be scared, of meeting a doctor. All right. Now, I think clearly Nigeria has always been in what I call a revolutionary situation in all sectors of its economy, including the health sector. And so there's no better time than now to re-emphasize that even within the health sector, there's obviously need for some level of urgency. I mean, because if you look at all the parameters, all the indicators, they're not very, alluring at all. And so any government that comes in must necessarily, undertake that kind of intervention to ensure that some level of, relief is, accrues to Nigerians. Because if you look at, for instance, the fact that a lot of Nigerians are living in, very pitiable levels of poverty, cannot afford healthcare, and look at even the skyrocketing prices of commodities now, healthcare commodities and all of that. Most Nigerians are still indulging in catastrophic health expenditures. So there's that level of urgency that is needed to say, look, how can we save Nigerians from further, undergoing this kind of hardships in the process of, guaranteeing their safety, their healthcare, their well-being? If you look at even the healthcare providers, how do we rescue the almost complete, in fact, virtual absence of practitioners, healthcare workers in some health facilities in the country? I mean, we are no longer, it's no longer news that in some hospitals, even big-time hospitals, you're having several departments being closed down because of the whole challenge of, the Japan syndrome, which is now, the whole brain drain phenomenon. So how do you talk about healthcare security? How do you talk about the safety and the security of healthcare workers who are even supposed to, be at the point of care, in terms of delivery of services at the point of care? So clearly, we have an emergency on our hands. And I think the government has gotten it right in terms of, committing itself, to, of course, undertake some level of rescue operations, if you like, to, of course, redirect the fortunes of the healthcare system and, of course, the whole, economy of Nigeria. But I think it's not enough to accept that reality. What has always been missing is to put, some level of action to all our, theoretical constructs and concepts. And so the need to walk the talk is what is important. And I think that should be our conversation today and even subsequently. That's beyond prescriptions. We've had these prescriptions before. We've had these admissions before. I mean, here in this country, we had a Secretary of Government of Federation publicly admit that he never knew that the decay, in the health sector was phenomenal, was phenomenal. I mean, now you admitted that. What has happened since that admission? I mean, so clearly Nigeria needs to have some level of urgent steps taken to attend to a lot of the levers, a lot of the enablers that, of course, will turn around the healthcare fortunes of our country.
So you have described what should be, but my question to you is that what is now? Do you sense that urgency just before Bukola comes in? Do you sense that urgency? I know that with medicine, there needs to be urgency. That's why you have emergency, you have all of those things. So do you sense that urgency from this Tinubu administration so far?
Yeah, I sense that urgency clearly, because a lot of the foundational steps have been taken by the government. First, like I said, I commend them for accepting that basic health care is a matter of fundamental rights and, of course, a matter of long-term security. That is only to emphasize the provisions of the National Health Act as guaranteed in Section 3, subsection 3, which, of course, obligates government to provide healthcare services, at least a basic minimum package of healthcare services to Nigerians. So clearly, I appreciate the kind of urgent steps they are trying to take, but they are still foundational. What I'm saying is that beyond these foundational steps, in terms of emplacing the policies, the frameworks, the mechanisms, Nigerians are in a hurry to see these mechanisms giving some level of push in terms of implementation. And I think that will make the difference between this, the narratives we've had in the past and the narratives we're now having. So once they're able to put action to a lot of these policy frameworks, then Nigerians can begin to see a difference. Right now, I can only say, yes, I sense some level of urgency, but whether that sense of urgency will translate into actionable steps, into positive outcomes, into population health, I cannot say for now, because this is just 1 year of the 4-year tenure of this government. And of course, clearly, a lot still needs to be done to make sure that Nigerians move away from this whole idea of developing policies that remain in their drawers, remain in the cupboards, and of course gather dust, with us coming back again 10 years after to, of course, dust those files and the same seesaw vacillations that have characterized, past regimes. So I think clearly that is the difference we need to see. Right, so how do we put these policies into action?
So let's take a look at those policies and do a proper breakdown. And I'll begin with a very vital one: primary and secondary healthcare. In the manifesto, the promise made by President Bola Tinubu, this is what he said: deploying adequate infrastructure and human resources to address maternal and child care, immunization, managing preventable diseases. Now, that's a summary of the promise he made in that Renewed Hope manifesto regarding, the primary health care and secondary health care. 1 year into the office or into the administration of this government, we've had some reports across board from primary healthcare centers to secondary healthcare centers, and they leave much to be desired. Is that what you also see when you look across board, particularly primary and secondary healthcare?
Yes, certainly. Primary healthcare remains the bulwark of any healthcare system. Sooner than later come to its peril. So every government needs to place emphasis on primary health care, but how you do it is also different. So I clearly appreciate the decay that is preeminent all across the country in terms of the primary health care. But we now say that primary health care is virtually non-existent in most of our states across the country. But I do not, deny the fact that some state governments are doing their bit to see how they can revitalize primary health care, because actually primary health care remains within the jurisdiction of the local government administration. Even though now most of the state governments have taken over that level of intervention for primary health care. So, but I think what is real is that we still lack, very vital, very functional, operational primary health care systems across the country. And that needs to be really, really engaged, because like I said, there's a linchpin. A primary healthcare system is the linchpin of the healthcare system. It's the bulwark of the healthcare system. And so once you get it right, in terms of not only the infrastructure, but of course the component parts, the human resource, that needs to, of course, drive processes within those facilities, then of course you can begin to, of course, say that you're inching towards a very robust, strong healthcare system. Because again, along with that is the need to, of course, revitalize the general hospitals, the state government hospitals, and of course, hoping that the federal government will do its own bit to put more emphasis on how to, of course, develop specialist care at the tertiary level. So it's a concatenation of processes. They are all interlinked. So if you emphasize interventions in one aspect without also doing others pari passu, then of course you may not be able to get that kind of robust healthcare system that you want to have, because the national healthcare system is a concatenation of these pieces and these subsets. And of course, I think emphasizing on primary healthcare, which actually should attend to over 70% of the disease burden of citizens anywhere in the world, in any nation, is currently not doing that. A lot of cases are going to the tertiary healthcare centers because people are no longer confident to procure healthcare in the primary healthcare centers. Some of them are extremely dilapidated. They lack the component staffing, and of course the equipment are not there. And that is supposed to be a forum and avenue for integrated care. Integrated care in the sense that every other condition that you have, some level of basic attention can be given at that level, even prevention, even promotion, health promotion. And of course, all of that, vaccinations, are driven through the primary care system. So there is no better time than now to see how we can bring up that level of care
Indeed.
to a level where it can begin to, of course, attend to most of the disease burden that Nigerians are currently grappling with.
Indeed, Dr. Enabulili, and it may seem that the federal government is in acknowledgement of the state of primary health care systems in the country. And I'm going to be following up on that. But in the meantime, let's welcome Jeffrey. Jeffrey joins us now. Finally, Jeffrey, it's good to see you.
Thank you.
Welcome. And also joining us from our Abuja studio, we have Dr. Kayode Adeshola, the National President, Association of Nigerian Private Medical Practitioners, ANPMP. He's also the Managing Director, Prime Health Gate Medicare, Lagos. He joins us from our Abuja studio. And Dr. Adeshola, I'm coming to you now with a follow-up on the conversation on primary health care, which, as Dr. Enabulili has acknowledged, should really cater to 70% of healthcare needs in the country. With the deployment or approvement, if you like, of 25 billion naira as funding to the National Primary Healthcare Development Agency in the country, what are expectations of that funding? And are you satisfied with the implementation strategy so far deployed by government to enable it to move fast enough to achieve its goals within the 2-year period that it promised for the revamping of primary healthcare systems in the country?
Thank you very much for having me, and thank you very much for having me. I'm not hearing.
Go ahead, Dr. Adeshola. We can hear you loud and clear. Go ahead.
Okay, I wasn't hearing I didn't get your concluding part, but I think talking about the primary health care, the efforts of the federal government, the current administration at addressing some of the problems of the health sector through galvanizing and strengthening the primary health care. Everybody agrees that the primary health care system should be the fulcrum around which the health system is built. And if we do that successfully, it will have taken care of a lot of challenges in the health sector. Now, talking about the money deployed, the government of President Asiwaju Bola Ahmed has actually attempted so far to put in the very best of resources, starting with the managers, the coordinating minister, Professor Ali Pate, and the Minister of State, Dr. Alausa. Of course, the other lieutenants also heading the National Health Insurance Authority, Dr. Kelechi Oiri, and the National Primary Health Care Development Agency. Now, talking about the Primary Health Care Development Agency, I think they have good intention, and I believe the way they are going, trying to restructure things, this 1 year might not have been enough to actually pass a judgment on the primary health care development, but we must also not forget to always remind them, like my world president, Dr. Enabulili, mentioned, the building of infrastructure alone will not run the system. We also need to consciously invest in human resources. These are people that will drive the system, that will use the infrastructure. So in the last 1 year, that attempt is being made. That's why that much money has been voted in that direction, 75 billion, and we are all very anticipating good results from the implementation. We cannot do without the primary health care, a very robust one for that matter. It's going to be the backbone of the health sector in the country. So we wish the head of that agency, Dr. Aina, the very best. And of course, we are always there to give a very good support to make sure that this comes out a big success. Because like I said, the primary health care remains a fulcrum for the health sector to have success.
All right, as we move on now, you have also touched on a very critical aspect of the promised deliverable in the manifesto of then candidate and now president, which is caring for healthcare workers and job creation. And therein contained what is promised is we will embark on a focused manpower plan to increase the number and enhance the skill sets of our healthcare workers. That's what's promised. Now we have joining us the third man of our three-man panel from Zoom, not Dr. Osahona. We have joining us Dr. Kashmir Ifeanyi, National President, Association of Medical Lab Scientists of Nigeria, Medical Laboratory Scientist, PhD in Molecular Microbiology, and Public Health Policy Analyst. Thank you for joining us, Dr. Ifeanyi. So let's look at what's promised as far as welfare of healthcare personnel is concerned. We started off by talking about whether or not there is a visible sense of urgency in addressing the very huge concerns in the healthcare sector. Do you sense that response approach by this current government to the healthcare concerns of the welfare, either it's of resident doctors or nurses, particularly in the policy disposition of the government towards remuneration and all the other issues that have dogged that sector and seen a different series of strikes in the last couple of years? Dr. Ifeanyi, please take that.
Thank you. Good morning, viewers. Good morning, Nigerians. I must say that I took particular interest in studying the renewed hope agenda for the health sector as articulated by our President and Commander-in-Chief, Senator Asiwaju Bola Tinubu. And that was quite fascinating for me. It attracted me to his candidature. But I must say that 1 year down the line, a whole lot of that is yet to be translated into tangible, evidential realities. You spoke in your intro now copiously about the issue of welfare. And I want to categorically say that it is because of the want of welfare that Nigerian healthcare professionals, including medical laboratory scientists, are leaving the shores of the country in droves. What do you call welfare? Whereas just this week, that is cascading down, my colleagues in Federal Orthopedic Hospital Ibobi were all denied promotion. And that matter is raging and may lead to some kind of industrial unrest again. They were discriminated against and denied promotion. The matter is on. All entreaties to the MD to do the needful had fallen on deaf ears. And you speak about welfare. So youngsters in that hospital, who are my younger colleagues, when they jet out, we will now grumble that they are living in droves. I think discrimination in workplace, particularly in the area of promotion, it's unnecessary, is dastard and should be condemned. So I must say that the issue of welfare of healthcare workers in Nigeria is not, there's lip service and there's huge discrimination. Now, when you speak about welfare, whereas a given salary structure has been serially reviewed upward and the current salary structure has remained static since 2009 till date, and you speak of welfare. why wouldn't people leave? Now, having said that, I had followed this conversation. Look, if you go to primary healthcare that you discussed earlier on, I am passionate about primary healthcare. We have, in Nigeria, we have hundreds, I mean, over 40,000 primary healthcare centers. And out of this number, you would not find effective and efficient medical laboratory services in up to 5,000 across the country. When the erstwhile government came, the then Minister of Health, Professor Isaac Adewale, came with what he called model primary healthcare centers. He activated one in Kuchinguru in Abuja. I challenge you as members of the Fourth Estate of the Realm, take a tour, do a pilot study, do a comparative evaluation of the primary healthcare centers in Kano State, in Jigawa, in Sokoto, in Enugu State, in Akwa Ibom, in Uyo, and compare if you will find any one that look like that one in Kuchinguru, Abuja. So there's been a whole lot of conversation about rejuvenating the primary healthcare because that's the first port of call for those who seek healthcare service. But it's been mere on paper, buzzwords, audio conversations, nothing tangible on the ground. Why? Now, before this government came, sometime March 2022, there was a review of the minimum package for health. I would want to shock Nigerians and our listeners. You would not find laboratory component in that revised minimum package for health, which is accessible at the primary healthcare level, which is supported by the money deriving from the 1% consolidated revenue fund. That is not helping Nigeria. The reason why we had continued to occupy the rock bottom ranking in health indices globally, which hover around 188, 189 out of 192 countries or thereabout, or that hover between 48 and 50 out of 54 countries within the African continent. So both globally and within the continent, we have occupied these lower rungs because of weak laboratory system.
Needs in that manifesto. But let me take a look at this one, and it talks about the next public health emergency. And the promise in the manifesto of the president is to improve public health response preparedness and infrastructure, of course, for the next public health emergency. Who knows when it will be? Hopefully not anytime soon, but they always say hope is not a strategy. So, Dr. Ifeanyi, let me come to you because you'll find out that some tests that you want to do, high-end tests, to tell you we don't have the machine here or even in these states, so you have to travel to another state. You go there and they tell you, there's a long queue or something like that, and it's befuddling to see that. And as a matter of fact, looking through the manifesto, I was trying to look through if we'll see anything about medical tourism and reducing it. It's not quite stated there. So you see the president, for example, still seeking medical help and attention abroad. You see other government officials doing the same. So it's an irony, really. And I want us to speak to that, because until the point we get to that president and public officials are able to seek medical attention right here in Nigeria, I don't think we'll have made any much progress. Dr. Kasmir Ifeanyi.
Well, we must do a root cause analysis. Why do people go abroad? Do they go abroad to see skyscrapers? The answer is no. We have some in Nigeria. They go abroad because the medical laboratory system in Nigeria is weak. Maputo Protocol 2008 said if you want to strengthen the health system of a nation, you have to develop and expand its medical laboratory services. We have been at it since 2008 till now. Like you rightly said, we are yet to get it right in the area of medical laboratory services. Now, speaking to the manifesto and what had been operationalized from the manifesto, sometime, I think last year, after the inauguration, there was a launch of the universal coverage, part of the Renewed Hope Agenda promise. It was launched. I took that document. I studied what was provided in that launch to encourage access. And I also discovered that it is poor in medical laboratory service component. In fact, it is non-existent. So until we get it right with the medical laboratory service, we will continue to have our people leave the country and spend billions of dollars per annum in medical tourism. We need to get it right. And how do we get it right? We must realize that the National Health Act had provided for 1% fund, and that 1% is for equipping of primary health care centers. And that equipping should speak to issues of providing medical laboratory equipment and consumables to activate laboratories. I want the new Executive Secretary of the National Primary Health Care Centers, Development Agency of Nigeria, National Primary Health Care Development Agency of Nigeria, to tell us who regulates what happens at the National Primary Health Care Centers in Nigeria. Without any form of superintendency and regulation, you would not expect much. Many of them are sleeping pens for goat and sheep. We need to speak to that. This government has done a few that we must single out. Right. A couple of months ago, the coordinating Minister of Health announced the approval by His Excellency President Bola Ahmed Tinubu of interventions in some tertiary hospitals. And one of them was particularly of interest to me when they talked about investment in clinical pathology. I do not bother much about the name because the pathology family has just two people. And so if they are doing conversation around clinical pathology, they are speaking to my constituency. Well, again, it is also very bogus a document. The details are not fine-tuned. So when you use the word as omnibus as clinical pathology, you are wrapping it around. Well, open it up. Let us see what you are speaking to. What is this level of medical laboratory service provision you are speaking to? Right. I want to show you, we do not have a structure that coordinates medical laboratory services till date at the Federal Ministry of Health.
I must come in now. You've made a point about being specific, I mean, being targeted in making these pronouncements, and it's quite important to make. But as we wind down, we're just closing in 30 seconds. I want you three gentlemen to give a quick rating to this government 1 year into this administration. Scale of 0 to 100. I'll start with Dr. Ifeanyi. What would you rate this government? A pass, average, excellent, fair?
1 year is 25% of the mandate he has. And if we're going to rate him, we shouldn't rate him over 100. We should rate him over 25. So if we do over 25, I will give him 10 over 25. There's a lot to be done, plenty in the books, in the documents, not activated. And they need to engage more with critical stakeholders, critical clinical professionals.
So that's a 40%. That's a 40%. Okay, let's go to Dr. Adeshola. Your rating. So Dr. Ifeanyi, 40%. What would you rate this government quickly?
Well, my rating, it's a bit difficult when you don't have all the indices to use to judge. But then my rating for now, because of the foundation we think they are laying, will be in the range of 30, 40. And I must seize the opportunity again to remind them that previously many governments have come, and most of the policies have always been targeted at the public sector. And without the 70% component, which comes from the private sector, there will never be a pass mark.
Important point you made there.
You cannot pass an exam concentrating just on 30% of your syllabus.
Absolutely.
We must continue to remind them this.
Absolutely. And let's go to Dr. Nabulele. What would be your rating?
Yeah, thank you very much. If I were to use the fact that they profess that within the first 2 years, they will cover 40% of Nigerians will be covered by health insurance. Right now, we have less than 7% of Nigerians covered on health insurance. So you can do the mathematics. So clearly, I will score them 35%, for now. That is not to say that the foundational steps have not been taken, but we hope in the second year we'll begin to see some manifestations of all the pronouncements and narratives and the roundtable workshops and all of that.
Well, we look forward to manifestations. After all, maybe that's why it's called a manifesto. But we'd like to thank you so much, gentlemen. Dr. Osahoin Nabulele, immediate past president, World Medical Association. Dr. Kasmir Ifeanyi, national president, Association of Medical Lab Scientists of Nigeria. And joining us from our Abuja studio, Dr. Kayode Adeshola, national president, Association of Nigerian Private Medical Practitioners. It's quite interesting, really, because the question I was also going to bring up is about, that voluntary membership of a Nigerian Medical Association. But we'll take that on in the coming days. But we'll go to break now. And when we return, we'll turn our attention to doing business in Nigeria. The MPC, that's a committee, raised the interest rate yet again. But how is this affecting businesses, manufacturers? We'll take on that big one in a moment. Stay with us.